Diabetes basically means too much of glucose in your circulation. That means in your blood there is too much of sugar. And we have two major types of diabetes. There are even other forms of diabetes, but the two major ones are what we call type 1 and type 2. So type 1 diabetes occurs when you have absolutely no insulin in your body. So there is a gland called pancreas in your body, and that secretes insulin. It synthesizes and secretes insulin. This insulin is necessary to push the glucose from your bloodstream into the various tissues. So if you don't have insulin in your body, then the glucose stays in the blood and is not getting utilized by any tissue. So that is what you get in type 1 diabetes, because the pancreatic cells that secrete insulin get selectively damaged. So your body has zero insulin or almost zero insulin when you start developing hyperglycemia. And this is essentially a disease where a patient will require insulin for survival. Without insulin, this patient eventually is going to have death, because there is no way the glucose will get controlled with any other approach rather than either replacing insulin or regenerating the pancreatic beta cells which produce insulin. Symptoms related to hyperglycemia or high blood glucose will be similar in both forms of diabetes. So you can have too much of urination, because there's a lot of, since the blood glucose is very high and it is not entering the tissues, it will get filtered in your urine. So urine glucose will be very high. So along with glucose, it will pull water also, which is why you have loss of water in the urine. So patients will have frequent urination, including in the night. Secondly, if the patient is losing lot of water in the urine, naturally they will become very thirsty, because they are losing fluid from their body. So they will have increased thirst, they will have increased urination. And like I mentioned earlier, if you look at, lot of blood glucose is there, but within the tissues or within each cell there is hardly any glucose. So within the cell there is paucity of glucose, so that triggers hunger, which is why patients with high blood glucose actually have severe hunger. So they'll have increased hunger, increased thirst, and lot of urination. And if the glucose is uncontrolled for a long period of time, they'll actually have weight loss. So these are the 4 cardinal symptoms of very high blood glucose levels, which is increased hunger, increased thirst, increased urination, and weight loss. Insulin resistance basically refers to the fact that the patient's body has adequate amount of insulin, but that insulin is unable to act. The reason why it's unable to act is, like I mentioned earlier, the patient's glucose is present in the blood. From the blood, it has to be taken up by each tissue in order to either utilize it for energy or to store it if you don't need it for energy. So the main storage organ is basically your fat tissue, what we call adipose tissue. Apart from genetic predisposition, typically the patients who are at high risk for developing diabetes, type 2 diabetes that is basically patients, people who have a lifestyle which can put them at risk for developing type 2 diabetes. So one is if they have a sedentary lifestyle, and classic example is actually doctors, because we sit through most of our working hours. So just like that, if anybody who is not really being physically active, you're predisposing yourself to develop diabetes, particularly if you have a background genetic predisposition. Secondly, the kind of diet that we use. So if you are some in the habit of snacking frequently or taking fried fatty foods and sugary foods, again this puts you at very high risk of developing type 2 diabetes. So improving your healthy lifestyle basically includes being more physically active and changing your diet. So these are the 2 main categories that you have to watch for. So if you feel that you're putting on a lot of weight recently, then it's a red flag. You better screen yourself for diabetes, and then following which, even if you do not have diabetes yet, I think it's a good lifestyle choice to start cutting down calories and improving your physical activity to keep your weight in check. The heart and kidney, maybe slightly we can delineate the 2. So the heart disease occurs partly because it's also driven by not just high blood glucose but also insulin resistance and the changes that occur in the blood vessels as a part of your insulin resistance and hyperglycemia or high blood glucose. So heart disease is prevalent not only in patients with type 2 diabetes and insulin resistance, but also again if you have a genetic predisposition to develop this, you may end up developing heart disease as well. Kidney disease, on the other hand, again is extremely common in patients with diabetes, any type of diabetes, and kidney disease is also linked directly to the degree of high blood glucose that you have and the duration of high blood glucose that you have. So the longer you have higher levels of blood glucose, the higher you are at risk for developing any of the complications. Reason for type 2 diabetes, we said by the time the patient develops high blood glucose, 90% of their pancreatic reserve is gone. But typically when a patient develops type 2 diabetes, more than 50% is still there. So at the time of you losing 50% of your beta cells, that's when you start developing a little bit of high blood glucose. So there is a very good chance for remission early on in the disease. So if you make a lot of lifestyle changes, have some weight loss, and adopt a very healthy lifestyle, definitely there is chance of diabetes reversal and you can stay in remission. But the most important thing is that, number one, just because you have reversed to normality, don't think everything is all right. Don't go back to the old lifestyle, number one. And number two, also monitor your blood glucose at least every 6 months, if possible every 3 months, because there is a tendency for you to again go back into the diabetes range. So frequency of monitoring is extremely important. Continuing the whatever healthy lifestyle you have adopted is also extremely important. So these factors, if you have, then it is all right.